Hello, everyone. I'm Yishan, and today we are going to talk a little bit about infection prevention, especially during this time of the COVID-19 pandemic. Today, we have with us Dr. Pang Yi Jack, who will be sharing with us a little bit on this subject. Dr. Jack, could you tell us briefly about the COVID-19 virus?
I believe by now everyone is a specialist about COVID-19 virus. So let me just refresh your memory a little bit. So COVID-19, actually it started in December 2019, a cluster of pneumonia cases, meaning lung infection cases, in the city of Wuhan in China actually arises. So an investigation found that the disease was caused by a newly discovered strain of coronavirus. And thus they named it the COVID-19. So we know coronavirus is actually a family, and they actually contain multiple different subtype of viruses. So, and coronavirus COVID-19 is just one of the strain. So it is important for us to understand how the COVID spread so that we can effectively prevent ourselves from getting infected. So COVID spreads primarily by attaching to the droplets you exhale, meaning to say when you cough, when you sneeze, when you speak. So they will be attaching to these droplets, and then they will be projected out. So as they become smaller aerosol, meaning to say when you sneeze, usually when you sneeze, the aerosol is very small, the water particle is very small. And when they get smaller, they can actually travel greater distance. So meaning to say they can be more infective if they are smaller. They can pass on to further away to people that are standing a bit further away from you as well. So the direct way of getting infected will be by inhaling or ingesting these water droplets or aerosol from an infected person. The indirect way will be touching contaminated surfaces like doorknobs, a keyboard, light switches, and then put your hand into your mouth, rubbing your eyes. These are the way you can get infected indirectly. So these are the two ways, direct and indirect. But still to this day, there is no available antiviral out there to cure COVID-19. So medical treatments are mainly supportive. That is why it is very important for public to get vaccinated so that we can achieve herd immunity as soon as possible.
All right. Thanks. Thanks, Doctor, for the information. All right, now we will discuss a little bit about the face mask that we have been using during this time of the pandemic. What are the different types of face masks, and what are their effectiveness? Perhaps you can tell us a little bit about that.
Yeah, sure. So as you can see now in the market, there are so many types of face masks available. So we have the 3-ply surgical masks that are commonly used by everyone. Then also we have the cloth mask that is being used, as well as the, not forgetting, N95, which offers the best protection. So aside from this, there are other types of masks as well in the market, such as valve mask or even bandana to be used as a mask. So multiple studies were conducted on how good are these masks? And here are 3 things that you need to consider when you're picking a face mask for yourself. Number 1 is filtration efficacy. So filtration efficacy definitely is the most important because that will determine how much of aerosol or water droplets that can pass through and you can potentially inhale. So undoubtedly, N95 offers the best protection overall. So they are often in short supply, and unless you are caring for someone that is infected or sick, the CDC still recommends saving them for the healthcare workers. And next, we look at reusable masks. So nowadays, there are so many types of cloth reusable masks that have different colors and designs where you can wear to fit your outfit of the day, you know. So reusable masks, they are, in a way, they are comfortable, and if you pick the right one, they work as well as N95 masks. And for the criteria that I mentioned, meaning to say the face mask, the cloth mask, reusable mask, has to be 3 layers, 2 to 3 layers thickness to have the effectiveness as close as N95. And the face masks need to be washed regularly. Then let's look into disposable surgical masks that is widely used. Disposable surgical masks, they have this non-woven polypropylene as the fabric, which can pull lots and lots of particles. And it is tested and proven to have good filtration efficacy if you buy from a proper source. Whereas for valve mask, bandana that I mentioned earlier, those should be thrown out. As multiple studies actually have proved that these masks actually offer very poor filtration efficacy. So yep, that's point number 1, filtration efficacy. Number 2 is mask fitting. So fit is the second most important thing that you need to consider when you're picking up a mask. No matter how pretty, how nice the color, how good your mask is, if it doesn't fit your face, then you have to put it back. So one way we can test if it fits you well is when you are wearing glasses or sunglasses. If they fog up while you're breathing with your mask on, then you know the mask doesn't fit you very well. It doesn't seal well. So meaning to say, I'm wearing a glasses. If I wear my mask and my glasses start to fog up, meaning the air is actually going upwards to my glasses and actually fogging up my glasses, and also downwards as well. So mask fitting is the second most important thing when you are picking a face mask for yourself. Number 3, of course, is the breathability and comfort level of your face mask. Because if it's not very comfortable, then people tend to not be very compliant in wearing them. I believe you have seen a lot of people are wearing their face masks below their nose. It defeats the purpose if you are doing that. So breathability and comfort level is an important point to take into consideration. So definitely soft cloth types are usually more comfortable in comparison to the N95. So in my line of work, I experienced wearing N95 face mask for a prolonged period of time. And trust me, it is not a walk in the park. So these are the 3 main points: filtration efficacy. Number 2 is mask fitting. Number 3 is breathability and comfort level. So these are the 3 things that you need to consider when you are picking a face mask for yourself or for your loved ones.
All right. Thank you so much, Doctor. What about double masking? We've heard DG Noor Hisham and the US Centers for Disease Control and Prevention tell us to double mask recently. Could you tell us a little bit more about that?
Yes, that is a very good point and question that is being raised. So actually, when we say recently, it's actually started since March 2021, where the CDC has actually recommended double masking, as it is proved to have better protection in terms of blocking the virus to spread outside or blocking the virus out from going inside. So the recommendations are wearing a cloth mask on top of a surgical mask, or tying a knot on surgical mask, which produce improved protection against the transmission and exposure. So they do not recommend double masking on disposable masks or layering another mask on top of the N95.
All right, thanks. In addition to our discussion on double masking, after more mutations and variants of the COVID virus, do you think we might head towards the direction of having to wear 3 masks or 4 masks or anything like that?
That's interesting, as because who knows, as we understand the face mask, we understand the COVID virus more and more recommendation will come up. But the important thing is to focus on protecting yourself with the latest recommendation. And again, vaccination. You have to get yourself vaccinated to protect yourself, to protect your loved ones and the people around you.
All right, yeah, that's interesting. And can you tell us more about the use of a face mask with a face shield?
Which I think I do not have a number or a statistic that prove between double masking or wearing a face mask with a face shield on. Like, I don't have this comparison data, but as of now, the latest trend is or the latest recommendation is to wear double masking. So why not wear double masking and on top of that wear a face shield? Then it offers even more protection. If you get what I mean.
Okay. All right. Thanks so much, Doctor. Is there anything else you'd like to add before you go off?
So the take-home message from today's interview is mainly number 1, how to pick your face mask. So how to pick it, back to the 3 points that I mentioned: filtration efficacy. Number 2 is the mask fitting, make sure it fits you well. And number 3 is the breathability and comfort level. And these are the latest recommendation. And the recommendation by CDC is to wear a surgical mask, and on top of your surgical mask, place a cloth mask outside of your surgical mask. And it is recommended that you tie knot around the ear loop of your surgical mask to offer better protection. So these are the 2 points that I would like you to remember from this interview.
All right. Thank you so much, Doctor, and I'll see you again next week.
Thank you very much, Ishan.
All right, that's some good info from Dr. Jack, and I hope you've learned a few things. Now, I'm going to get Miss Amelia to expand on the previous session. Hi, Miss Amelia. Could you just tell us briefly about yourself and a little bit about SM Healthcare?
Hello, I am Amelia, the sales manager for SM Healthcare. Well, SM Healthcare is actually a medical solution provider company. We've been around since 2009. We have been registered with MDA. And our core business in SM is actually that we are supplier, we are vendors to hospital. We supply equipment, instrument, and of course, disposable product.
Nice. All right. Earlier, we had Dr. Pang telling us a little bit about face masks and face shields. Maybe could you please just tell us a little bit more about it?
Yishan, I think this is not a foreign topic, face masks. Even today, during our pandemic each and every one of us, it's actually a mandatory to wear our face mask out. And one of the things that people ask is that, is my mask giving me the protection that I need? So in SM Healthcare, we have a variety of masks whereby we have the disposable 3-ply mask. We have that available. We have the N95, which also fall in the category of a disposable mask. And now at the moment, our top sales is actually our 3-ply washable mask. It is really cute, but on top of that, it's actually breathable, it's comfortable. But then end of the day, Yishan, I think the most important thing is that you choose a mask which suit you. You know, sometimes what I like, you might not like. So end of the day, we just need a mask which gives us the protection that we need and is comfortable to us. So yeah, that's some of the masks that we have in SM Healthcare.
All right, thanks so much, Amelia. Is there anything you would just like to add before you go off?
Yeah, please, for those who are interested or you have any question, do connect with us on our social media. Do visit us on our website. We have our own platform, smhealth.store. Yeah.
All right. Okay. Thank you so much, Amelia, for your time. I'll see you again.
Bye.
Bye. All right. And that's all we have for today. Thanks for tuning in. If you've learned something today, make sure to share this with someone else who would benefit. Sharing is caring. Also, do check out the link in the description to find out more about all that's been shared earlier. We'll be having a couple more informative sessions like this in the upcoming weeks, so stay tuned. If you like this, and let us know in the comments, and make sure to like and follow us on Facebook and Instagram, and subscribe to our YouTube channel. Finally, do take care, stay safe, and we encourage all of you guys to get vaccinated as soon as possible. Bye.